It is also synonym as hospital-acquired infection (HAI). Nosocomial infection is an infection that infects the patient in a hospital that resistant to antibiotics. It is also infect the patient that are written and occurring when she or he already discharging from hospital by showing the symptom. That means that hospital or that location is consisting virus and bacteria. Not only that, staff also will be infected by this infection.
According to the CDC, the most common pathogen that cause nosocomial infection are Staphylococcus aureus, Pseudomonas aeruginosa, and E. coli. The most common nosocomial infection are urinary tract infection, surgical site wound infection, respiratory pneumonia, bacteremia, gastrointestinal, and skin infection.
Nosocomial infection can hit a huge impact where it can lead to more severe diseases and more severe infection. For instance, severe pneumonia. Severe pneumonia is an inflammatory condition of the lung where it can affect primarily the small cells of the alveoli. The symptoms of the severe pneumonia is the productive of the phlegm. The most common causes of the nosocomial infection is bacteremia. Bacteremia is the presence of bacteria in the blood, which can lead to huge infection and can lead to the nosocomial infection too.
First, hand hygiene. Hand is the most common medium in transmission of infections. Wash hands if possible with soap during interactions between patient and healthcare personnel. This includes before touching the patient, before performing clean procedures, after body fluid exposure, after touching the patient and their surroundings. Second, wear proper personal protection equipment such as masks, gloves, and eye protection when conducting patient care activities and procedures. Lastly, clean and disinfect patient care areas, especially areas that are close to the patient.
It is clear that nosocomial infection is an infection that affected most patients, visitors, and healthcare workers in a hospital. There are some precautions that have been implemented at every hospital, such as isolating patients and practicing hand hygiene. This will allow the infection rate to decrease and prevent harmful diseases to a lot of people. In a case where anyone is infected, the nosocomial infection will affect badly where it can lead that person to several diseases and more severe infections. This is exactly why prevention is better than cure. All hospitalized patients are susceptible to contracting a nosocomial infection. Some patients are at a great risk than others, such as young children, the elderly, and a person with compromised immune systems. Other risk factors are long hospital stays, failure of healthcare workers to wash their hands, and overuse of antibiotics. Therefore, it is very advisable for them to be aware of this infection and use the precaution steps that have been stated earlier. If you develop the symptoms of this infection, you should immediately seek the required attention from a doctor at your nearest hospital.